multiple cars that have been parked here in the parking of Vegas Mall. These are the people who have taken their jabs done, who have got their jabs done, and now are waiting for an observation period. So this is one initiative. It is important because we know that the vaccination process in the national capital has been comparatively slow, and the chief minister has been complaining of the fact that there are very less vaccine in the national capital. He has said that where the national capital needs around 80 lakh doses of vaccine, what they're getting is very less, according to around only 10%. The chief minister has also made an SOS call to the Prime Minister saying that the national capital needs more vaccines because the vaccination drive needs to be increased. As we know, the bout of coronavirus cases was massive in the national capital. There were 30,000 cases being recorded every day. And now the government of Aam Aadmi Party of the Union Territory of Delhi has said that for June they have only been promised around just 8 lakh vials of 8 lakh doses of the vaccine where they need 80%. So that's just 10%. One other complaint that has been made by the Delhi government is that the private players like Moderna and Pfizer, they are not collaborating with the state government as they wish to speak to the center. However, at the same time, such drive-in initiatives, it is very important because this will give an impetus to already ongoing vaccination drive in the national capital. We know that because of dearth of vaccines, this entire drive had come to a temporary halt. But we can see once again it is kicking in, and we can see that this jab is now being administered one by one. The people here of the national capital are taking their jabs done. The vaccine is being administered by the medical staff here of the Ashok Healthcare, and this is the driveway which has been set up from today, and there's a sit-in also inside. However, the driveway is a more convenient place for the people of the national capital where they can get their jabs done on through the way, and it is a more easier way. It is a common phenomenon in the West. However, we are also getting upon that because India is a very large country with a heavy population, and everybody needs to get their vaccines done. They have to get themselves vaccinated. And as you can see, it is a very elaborate setup that has been put here, very streamlined. You can see all 3 counters, then we have the parking, and this is the setup that has been made today, and one after another people of the national capital are coming forward and getting their jabs done.
दिल्ली में युवाओं की वैक्सीन ख़त्म हो गई है। पिछले 4 दिनों से युवाओं के वैक्सीनेशन सेंटर बंद पड़े हैं। बुजुर्गों की कोवैक्सीन भी ख़त्म हो गई है। हमने केंद्र सरकार को लिखा है, लेकिन अभी तक वैक्सीन आई नहीं है। और ये केवल दिल्ली की बात नहीं है, देश भर में कई टीका केंद्र बंद हो गए हैं। इतनी महामारी के दौर में इस वक्त तो हमें रोज़ नए नए केंद्र खोलने चाहिए थे। ऐसे वक्त में मौजूदा केंद्र भी बंद हो रहे हैं, ये अच्छी बात नहीं है। देश में वैक्सीन की ज़बरदस्त किल्लत है, और मुझे लगता है पिछले महीनों में कई बड़ी गलतियां हुई हैं। अगर अपने देश के लोगों को सही समय पे वैक्सीन लगा दी जाती तो शायद दूसरी वेव के प्रकोप को काफ़ी कम किया जा सकता था, कई लोगों की जान बचाई जा सकती थी।
जो रिकवरी रेट है वो ज़्यादा बढ़ रहा है, और जो आंकड़े हैं वो ये बताता है कि अब हिंदुस्तान रिकवरी के राह पे आगे बढ़ रहा है। ये हम सब के लिए खुशी की बात भी है, राहत की बात भी है। और ख़ास करके दिल्ली में, जहाँ बहुत संख्या आज से थोड़े दिन पहले हम सबको देखने को मिल रहा था, वही संख्या में काफ़ी तेज़ी से कमी आई है। आज दिल्ली में केसेस अच्छे से मैनेज भी हो रहे हैं और लोग रिकवर भी कर रहे हैं। दुख की बात यह है कि ऐसी परिस्थिति में भी राजनीति हो रही है। आज 2 बार हमने टीवी पर अरविंद केजरीवाल जी को देखा है, और दोनों ही बार जिस प्रकार से झूठ, भ्रम, क्रेडिट की राजनीति और कहीं ना कहीं अपने आप को एक आगे बढ़ाने की राजनीति करते हुए वो नज़र आए। और मुझे लगता है कि इस प्रकार की राजनीति अभी नहीं होनी चाहिए। केजरीवाल जी, आप वैक्सीन के विषय में बोल रहे थे, अब कुछ वीडियोस भी दिखाया जाएगा यहाँ पर कि किस प्रकार से आपने यू टर्न लिया है। और आज आपको हम कहना चाहते हैं केजरीवाल जी, 20 करोड़ वैक्सीन 130 दिनों के अंदर हिंदुस्तान की सरकार ने तमाम राज्यों को मुहैया कराया है। और आज जब आप कह रहे हैं कि दिल्ली के पास वैक्सीन नहीं है, आदरणीय केजरीवाल जी, हम ये कहना चाहते हैं कि आज भी जब ये प्रेस कॉन्फ्रेंस हो रहा है, 1.5 लाख से अधिक वैक्सीन आज दिल्ली सरकार के पास मौजूद है। 1.5 लाख से अधिक, और 1.5 लाख कोई छोटी संख्या नहीं होती। आप इसको मैनेज करिए, किस प्रकार से दिल्ली के लोग वैक्सीनेट हो सके, सुचारू रूप से ये विषय आगे बढ़े, इसको आप देखिए। मगर हर दिन 2-2, 3-3 प्रेस कॉन्फ्रेंस करके आप इस पर राजनीति करते हैं।
Vaccine supplies are in shortage and all states are asking for more doses of the vaccine. Now, how much of vaccines being given to the states are being wasted? There was some data released by the Centre and the Health Ministry on Wednesday. Let's look at the data. The Centre is telling the states limit the wastage to less than 1%. Less than 1% is okay, is what the Centre has said, even though they tell you that zero wastage should be the policy. National average across India of vaccine wastage is around 6.3%. That's how much of vaccines we are wasting. 6.3% of vaccine doses are being wasted. What are the states that are contributing to vaccine wastage? The top 5 states, let's look at them. Jharkhand, 37.3% of vaccines are being wasted here, which means 1 out of 3 doses are going waste. Let's look at the other states. Chhattisgarh, recording about 30.2% of vaccine wastage. The state government there has said that they contest these figures and they want to update the centre with the latest figures on this. So we'll wait and watch on that. Other states recording vaccine wastage. Tamil Nadu recording about 15.5% of vaccine wastage. There has been vaccine hesitancy seen in the state as well. Jammu and Kashmir also recording vaccine wastage about 10.8%. The administration there trying to ensure that there is an effective rollout and campaigns are much better so that people come out in large numbers and ensure that there is no wastage. Madhya Pradesh, the 5th state, recording the highest number of doses being wasted, recording 10.7% of vaccine wastage in India.
Hardships that she faced did not deter her. Sita Devi started what is an O2 auto, that is what we can see out here. The O2 auto that has been kept here at the Rajiv Gandhi Government Hospital not only has oxygen that is being provided for the people who require oxygen, COVID patients, but it also ensures that those people who are requiring medical attention and who need to be taken for scans or several other medical emergencies as well can avail this O2 auto that has been set up here. She had lost her mother on May 1st at Rajiv Gandhi Government Hospital, right where we are standing at, after she was not able to provide oxygen, and following her mother's death, she had vowed to ensure that no other person will have to go through the hardship that she had faced, and that was why the O2 auto was born. Running a charitable trust as well here in Chennai. Not only is she running this O2 auto in across Rajiv Gandhi as well as several other hospitals, but per day almost close to 20 to 25 patients receive services of this auto that has been provided here, with 3 drivers that have been kept in place and almost close to 300 patients who have been treated so far with the help of this O2 auto. She aims to ensure that more autos will be deployed and more people will avail the services of free oxygen. Even as the increasing number of COVID cases here in Tamil Nadu are seeing a gradual decrease, the Tamil Nadu government has extended yet another lockdown week. that is starting from May 24th until May 31st. A total lockdown has been set in place here by the Tamil Nadu government owing to the rising number of COVID cases. Other than emergency services, no other vehicles will be allowed to move across the state here. All passengers who are willing to travel across districts will need to mandatorily have a e-pass that will be issued to them via the government portal that has been implemented. We're here at the Coimbatore bus terminal, which is one of the busiest bus terminals here in the city, and as you can see, the entire terminal is deserted with the new restrictions and regulations that have been set in place by the Tamil Nadu government. What is usually stacks and stacks of buses that will be gathered here, and public who will be gathered here to take buses back to their homes or to their hometowns, is now completely deserted. This is one of the busiest bus stands here and one of the main terminals for passengers to travel to from Chennai to either districts or back from districts to Chennai. Here, Madhavaram bus stand as well as Coimbatore bus stands are the two busiest bus terminals here in Chennai city. And with the total lockdown that is implemented, not only are passengers not able to travel back, but those who want to travel back will have to mandatorily take an e-pass that they will have to take after registering themselves from the Tamil Nadu government portal. Sources say that with the number of cases rising per day, yesterday Tamil Nadu recorded 34,000 new COVID cases here, 4,000 new COVID cases from Chennai city alone. Sources say that most likely, with the discussions ongoing, there is also an expected extension of the lockdown here in the state.
Well, if you see, I am currently present at the Sri Ramchandra mission here in Chennai, and this private ashram has volunteered themselves and they have given nearly 50 beds to the people who have been suffering from COVID and who are people who have been suffering from bed shortage. So if you see, this ashram has started with 50 beds, and they have been telling that depending on the increase of COVID cases and the crisis here in Tamil Nadu, especially in Chennai, the further bed allotments will be done. So for now, they have been started with the 50 bed over here in the ashram, and you can see the pictures where all the beds have been given with the proper mattresses and bed sheet, which will be also replaced daily. Along with that, fans have also been given over here for the heat temperature, and along with that, nearly 15 to 20 beds have been placed with the oxygen concentrators here in this ashram, and they have been also telling that within few days, depending on the crisis of COVID crisis, they will be allocating extra beds over here in the ashram. And along with that, nearly 50 beds have been placed for now. And I'll also show you the pictures where there's two sides been divided in the ashram, and that side will be totally allocated for females, and this side will be totally allocated for men's for this COVID. And along with that, they have also been given water purifiers for the patients who have been suffering from COVID. The special water purifiers have been placed over here in this ashram. They have been also telling that nearly 3 to 4 shifts of doctors and nurses will be taking care of this COVID care unit, and along with that, every 5 to 6 patients will be having a nurse for their treatment, and along with that, nearly 4 shifts have been allocated by the ashram officials over here to maintain this COVID, and nearly 50 beds have been placed for them. So in the upcoming days, depending on the COVID situation, they have also planned to start with extra beds, and along with that, they will be increasing the oxygen concentrators depending on the situation of the Chennai, and along with that, they are also planning to start a drive-in vaccination in Chennai, and that will be the first drive-in vaccination in Chennai. So for now, they have started with the 50 bed allotment here in Chennai, and in the upcoming case, depending on the COVID crisis, they will be allocating. I will also show you the pictures there. Two sides have been divided, nearly 25 beds on each side and 25 beds on the other side. Separate washrooms are given for men's and ladies, and they are also covered with screens for the dividing factor with the men's and women's. Also, special care will be given for the people who are getting admitted due to COVID, and also 5 to 6 doctors on every shift will be taking care, and nearly 4 to 5 patients will be in charge of one doctor, and they will be continuously monitoring the health and the COVID of the patients. Sir, you are continuously working on the ground. So how is the situation in Tamil Nadu, sir?
The situation is in control. Our leader, Chief Minister, and all the ministers, they were continuously doing our job. The situation is definitely under control. The only request is CM has already requested. We ask the public to cooperate with us and follow the rules properly.
The Madras High Court has warned Tamil Nadu government to get ready for them third wave, sir. So what all preparations is going on, sir?
All the preparations are going on as per the our leaders' advice, and we have a committee that advises us. So we are doing our best to control the pandemic.
As the cases of COVID-19 are increasing in rural areas of Jammu and Kashmir, last week LG Manoj Sinha issued an order asking the administration to set up 5-bedded COVID care centers in every panchayat of Jammu and Kashmir. And today on ground, when we try to check the reality, we are reporting from one of the panchayat girls in central Kashmir's Budgam district. As per the order, there should have been 5 beds and 1 supported with oxygen, but nothing like that is visible here. Only the 3 normal beds are there. There is no medical kit, no ambulance service, and in fact, no doctor or paramedic is present at this moment. In fact, this decision was only taken to strengthen the rural health infrastructure, and also maybe there might be some households who might not be having the facility of isolation when they have COVID-19 patients. But seeing the things on ground, it seems the Budgam administration is not taking the serious note of the order issued by LG Manoj Sinha. If we talk about the fatality rate, definitely it's a challenge for Jammu and Kashmir government still, although the active cases are coming down from 13% to 6.2. At the Panchayat, Gar sang every facility that a COVID care center requires. I'm joined by one of the employees of rural department. आप सर बताइए कि यहाँ पंचायत घर में जो कोविड केयर सेंटर का ऑर्डर हुआ था, लेकिन फैसिलिटी तो कुछ भी नहीं है अभी।
मैडम, अभी हमारे पास 3 बेड है, क्योंकि कल ही हुआ है कि मार्केट में भी ये नहीं मिलते इस वक्त, क्योंकि हमने बहुत कोशिश की है। अभी हमारा पंचायत सेक्रेटरी गए हैं और 2 बेड लेने के लिए, और बाकी जो ऑक्सीजन का जो मसला है वो तो गवर्नमेंट को करना है, और वो एम्बुलेंस का है वो तो मेडिकल को करना है। रूरल गवर्नमेंट को सिर्फ बेड रखने हैं, बस इतना ही हमारे यहाँ।
दैट मीन्स कि अभी भी जो है, हालांकि ऑर्डर तो लास्ट वीक हुआ है, लेकिन हफ्ते के बाद भी कोई भी फैसिलिटी ऐसी नहीं है जो ऑर्डर में लिखा है।
जी मैडम, वो तो बात सही है कि अभी सिर्फ बेड है हमारे पास, बाकी ज़्यादा कुछ नहीं है।
अगर कोविड पेशेंट कोई यहाँ आता है तो उसके पास यहाँ तो फैसिलिटी ही नहीं है।
नहीं, वो तो गवर्नमेंट को करना है।
With increasing COVID-19 cases, the Jammu and Kashmir government decided to establish 5-bedded COVID care facility in every panchayat ghar of the Union Territory of Jammu and Kashmir. But the reality is that these panchayat representatives, speech the sarpanch or the gram panchayat secretaries, they have done their work. They have established the facilities here, but the health department, they haven't done what they are supposed to do, as no doctor is available and a patient has been admitted here. His saturation is dipping below 80, but there is no doctor to take care of them, and that has now worried these public representatives. They are worried why, if the government has decided that there needs to be a doctor available at this COVID care facility, why isn't the doctor even responding to their calls? I'll request Sarjeevan to show you this. This is the details that have been shared, that the Panchayat Ghar Gagiyan, and the doctor on call with contact is Dr. Anjali Gupta. But what we have been told that she is even not responding to what they are saying. I am joined by the sarpanch of this area. Sarpanch साहब, मुझे ये बताइए, सरकार ने आपको कहा कि आप ये बेडेड फैसिलिटी बनाइए, आपने बना दी, तो अब डॉक्टर्स यहाँ पे नहीं है, क्या दिक्कत आ रही है?
अभी ऐसे हमें तो उद्देश्य मिला था कि आपके पास जो है यहाँ पे जो कोविड पेशेंट है उनको यहाँ पे बुलाना, और आपके एक डॉक्टर और 2 यहाँ पे एक नर्सें डिटेल की गई हैं, तो वो आपको यहाँ पे पूरा सहयोग करेंगे क्या प्रॉब्लम है पेशेंट को उसके मुताबिक। तो हमारे पास नेचुरली क्या हुआ, कल मेरी पंचायत में 2 पेशेंट जो है पॉजिटिव आ गए, तो उनको हमने उद्देश्य दिया और वो बेचारे यहाँ पे आके पहुँच गए और बोलते ठीक है हम यहाँ पे रहते हैं, क्योंकि गवर्नमेंट ने हमें ये किट भी यहाँ पे उपलब्ध करवाई है और जो हमारे पास कंटेनर है वो भी दिया है। तो उसके बाद हमें लगाना कैसे है, उसको क्या क्या ट्रीटमेंट देना है, वो तो एक डॉक्टर के ही नॉलेज में है ना, हम तो नहीं इसके बारे में इतना जानते। तो हमने डॉक्टर को फ़ोन किया था, लेकिन डॉक्टर क्या है वो नहीं पहुंच पाए सुबह यहाँ पे। वो उसके बाद क्योंकि उनकी ड्यूटी भी दबलैड में है, तो दबलैड से फिर उनका फ़ोन आया हमारे को तकरीबन 11:30 बजे। तो पेशेंट को थोड़ी प्रॉब्लम थी, उसकी ऑक्सीजन लेवल जो कम था। तो जो हमने बात की तो वो बोलते हैं ऐसे करो आप उनको ये ऑक्सीमीटर लगा कर उनकी ऑक्सीजन चेक करो। तो वो हमने की, उनका टेम्परेचर भी चेक किया, हमने उनका टेम्परेचर भी 99 से ऊपर था। तो उसके अलावा हमारी उनसे फ़ोन पे ही बात हुई थी।
आया कोई नहीं? आप?
हाँ, आया कोई नहीं। लेकिन उसके बाद फिर हमने क्या है एसडीएम को भी फ़ोन किया पे ऐसे ऐसे है, हमारे को तो इतना नॉलेज नहीं इसके बारे में, पेशेंट को कहाँ शिफ्ट करना है। मानते हम ये जो है एक अलग से सिस्टम बनाया गया ताकि जो गांव में किसी के पास ज़्यादा रूम नहीं है तो उनको अलग से यहाँ रहने का है। अगर यहाँ पे अलग से रखा है उनको, अगर उसके बाद उनको थोड़ी ज़्यादा प्रॉब्लम हो जाती है तो उसको हम सरपंच तो शिफ्ट नहीं कर सकता।
So very true, this coming from the sarpanch of the area, that they can only establish this facility, they can take care of it, but it is not their task that they ensure the doctors be here, and this is for the government to make it very sure that the patients don't suffer. With Sarjivan Kumar, Gursimran Singh for Republic Media Network. Vaccination drive for the age group of 18 to 44 has begun in the Union Territory of Jammu and Kashmir in a phased manner. Right now we are in the government high school in the RS Pura, and here the vaccination drive is underway for those who are shopkeepers or social welfare workers, along with the other those who are falling in the category of handicaps or those who are deprived part of the society. They are being given the COVID vaccination, and the important thing is that before getting the COVID-19 jab, they have to get themselves COVID-19 tested. This is very important because they said that there have been instances where people who are COVID positive, they were coming to get themselves vaccinated, and that is against the guidelines that have been issued by the Ministry of Health and Family Welfare. And that is the reason now here those who are coming, their details are getting entered, and post that they are being sent to the COVID testing center that has been set up just a few meters from this very place. This is a school actually that has been converted into the vaccination center, and there the vaccination drive is underway. I'll request Sarjivan to show that a person with the PPE kit, he is now conducting the COVID-19 test, and the persons they are going undergoing this test. This is really very important as this has been put as a mandatory step here to ensure that those who are getting tested or those who are getting vaccinated are COVID negative, so that the guidelines that have been issued by the Ministry of Health and Family Welfare, they are properly followed, and only those who are getting tested COVID negative, they are being allowed to get themselves vaccinated. This is really very important. We have seen how the cases are on continuous surge in the Union Territory of Jammu and Kashmir for the past 15 to 20 days, but now it seems that the graph is coming down, and post the test they have to come here where the vaccination drive is underway. They will be administering them the COVID-19 jab, and this is really very important because we have seen how even the directions have been passed to them to ensure that there is no wastage of COVID-19 vaccine. Madam, एक जो बॉटल होती है इसमें कितनी वैक्सीन्स जो जैब हैं वो आप निकालते हैं?
10 डोज।
आपको स्ट्रिक्ट वार्निंग है कि वेस्ट नहीं होना चाहिए?
नहीं स्ट्रिक्ट, अब ये हम वेस्ट कर नहीं सकते, इतनी कॉस्टली दवाई और इतनी इसी रिक्वायरमेंट है इस टाइम हमें, तो हम वेस्ट नहीं कर सकते हैं इसको।
Even in the remote areas, the directions have been passed because we have seen Union government coming up with a statement that over 10% wastage is being reported from the Union Territory of Jammu and Kashmir, but they are making it very sure that there is no wastage here, and they are also making it very sure that the people get a jab on time because they know the importance of this jab, the COVID-19 jab that has been given to them as a responsibility by the government. DRDO hospital being set up in the Union Territory of Jammu and Kashmir's Jammu region has missed its first deadline. Yesterday, Jammu and Kashmir Chief Secretary BVR Subramaniam, during a high-level meeting with the Union Home Secretary Ajay Kumar Bhalla, told that by today, that is from the 26th of May, this DRDO hospital will become operational in Jammu. But right now, we are at that very hospital and the work is still underway. And this DRDO hospital is in no condition to get operational today. We have seen how the bottlenecks were removed timely by the J&K government, and the process is in full swing. This oxygen plant is being installed. Even the 500-bedded hospital that is now being established. But yesterday, Jammu and Kashmir Chief Secretary told Union Home Secretary that it will start today. But